Coronavirus is spreading. What are we doing to keep you safe, and when should you cancel your appointment? I'm Catherine Nelson, owner of Del Sol Community Wellness. Thanks for joining me. Okay, so some of you may have seen my earlier broadcast. We were live and I had an audience here in the office and I was so incredibly nervous. So I'm re-recording. I'm here by myself. This is my third take. This will be way better. Okay, so we are going to talk about what we're doing to keep you safe and to stop the spread of disease here at the office, and we are going to talk about when to cancel your appointment. The first thing though I want to talk about is what you can and should be doing to stop the spread of disease, to keep yourself safe and to help keep others around you safe. The number one thing that you can and should be doing is wash your hands. Wash your hands with soap and water for 30 seconds. Hand sanitizer should be used as a backup option when you don't have running water and soap. You should wash for 30 seconds also. That part is key. 30 seconds is either singing the alphabet to yourself or singing happy birthday to yourself twice. Or certainly you could watch a clock if you have a clock, but 30 seconds is key. Soap and water, 30 seconds. The next big thing is to not touch your face or your hair. For us ladies, I've been wearing my hairpin back these last few days because it falls in my face. You know, you touch your hair, it touches your face. It's the same as touching your face. So those are just things to think about. It's a very hard habit to break. I'm having all these flashbacks to when I first started in the emergency department and I had to right away break this habit of touching my face. You don't realize how often you touch your nose, your eyes, your lips throughout the course of the day. It's a hard habit to break. I'm realizing these last few days that I have definitely fallen out of the habit, but it can be done, and it's a really important step to stopping the introduction of disease into your own body, and then certainly spreading whatever you might have out from there. The CDC, most healthcare workers that I know, the WHO, I think, they all also recommend that you keep a distance of about 3 feet when you're out in public. I think the WHO earlier said 3 to 6 feet. So as you're out and about, that's something else to keep in mind. Maybe just keep a little bit of distance between you and the folks that you're standing next to. Those would be things that you can and should be doing, and that would be true not just for the coronavirus, but for the flu, strep, as I said earlier, all those things that are communicable throughout the whole year. So now let's talk about the things that we're doing here at Del Sol to help keep you safe and help prevent the spread of disease. I want to say that all of the things that I am going to talk about are things that have been happening all along. Remember, I come from a healthcare background and we're doing healthcare here. Sick people come here. They've always done that, and they're going to continue to do that. And if that's true, you have to take some steps to stop the spread of disease. So that's always been the practice here. That stuff happens where you might not see it or hear it or know it's happening, but we've always been very proactive about preventing the spread of disease. Some of the things that we do, the first and foremost is all of the practitioners wash their hands before and after every contact with every patient. It's always been true. We've always done that. We're going to continue to do that. Hand washing, we just said, is the number one way of stopping the spread of disease. That's our big thing. We regularly clean and disinfect all common spaces. That includes doorknobs, faucet handles, light switches, all the things that people touch throughout the office, the arms of the chairs, all those things regularly are cleaned and disinfected. You just don't see that happening. We also regularly clean all of the equipment. Again, that happens after hours when you're not here to see it, but that's been going on from the beginning. We largely use single-use linens. That has been our practice up to this point, meaning for the most part, when you use a sheet or a blanket or something, a face rest cradle, then you're the only one that uses it. The next person gets a new one, and so on. You know, the one that always is overlooked, but one that's always been big for me, is I have you guys take your shoes off at the door. Your shoes are germy. You would be surprised to learn maybe that your shoes, the bottom of your shoes, are far germier than any doorknob, toilet seat, light switch, any other public thing that lots of people touch. Your shoes are dirtier. So I have you leave those at the door so that all those germs are not being tracked through the building every day, all day. But that's always been the case. These are things we've always had in place. So then what are the changes? We are going to make a few changes in response to the coronavirus because it is more transmittable, maybe by a small margin. The numbers, there's not a lot of information, but it does seem to be more transmittable than other things that we see throughout the rest of the year. So we're going to make a few changes. The first and foremost is that we're going to increase the frequency of our cleaning and disinfectant schedule, okay? That just needs to happen more often, so that's what we're going to do. We're going to move to all single-use linens for the time being. We are going to encourage you, when you come for a yoga class, we're going to encourage you to bring your own equipment if you have it. We will still have our stuff here and available for use, but we are going to ask that if you have your own mat, your own blocks, your own blanket, certainly your own eye pillow, we're going to stop using those shared eye pillows for right now. If you have your own, we would like you to bring it. It's going to help us stop the spread of disease. It's also going to reduce the number of things that we need to clean. So we will have stuff here available for you to use, but if you have your own stuff, please bring it with you for the time being. I also am going to be installing a countdown timer in the bathroom. And I am going to ask you to please wash your hands. When you come, and certainly when you use the bathroom here, please wash your hands. The countdown timer is a hand-free. You wave your hand in front of it and it starts to visually count down 30 seconds. So you need to wash the whole time that those lights are on. And we'll talk more about that once I get that thing installed. But that is one way that we are going to need you guys to step up and help us be responsible for your part in it. Help us to stop the spread of disease by washing your hands for the full 30 seconds. And that device that I will install in the bathroom will help you to make sure that the 30 seconds is there. So when do you need to cancel your appointment? At this time, or your class, your appointment or your class. So at this time, I want to say that we have no plans to cancel any of our classes. Now, I am watching all of the reports, all of the stuff that's going on with the outbreak and these cases in Larimer County. I'm watching all that stuff. We may come to a point in the future where we do need to suspend community classes for a period of time. We're not yet at that point, so we don't yet have any plans to stop having class here as usual. I will let you know immediately when that becomes necessary. If you have questions about attending a class or concerns, please get in touch with me. I want to talk about that, so please get in touch with me. As far as appointments go, my position, many of you know this because you've come in when you've been sick. My position on this has always been that if you're sick, I can't help you if you don't come in. There are a lot of things that we can do to help boost your immune system and help you accelerate in kicking whatever illness you have at that moment. There are a few exceptions. Over the years, if you have influenza, that's the one I do want you to stay home. Coronavirus now is going to fall into that category. But most of you don't have those symptoms. Most of you have something else, and it is good for you to come in because we can help treat you and get you back to healthy. Especially now that we have acupuncture as an option, that's even more true. There's even more things that we can do to help boost your immune system and help you get through your illness. So here's what I'm going to say going forward. If you are ill, if you start to show symptoms of being ill in some way, why don't you give me a call and let's talk about, or shoot me an email and I'll call you back. But let's actually connect and talk about what your symptoms are and make a determination about is it appropriate for you to come in, or is it wiser for you to stay home? If you are one, based on your symptoms, if it does sound like a good idea to bring you in and let us treat you, what's that going to look like? Do we need to go straight into a private room and not have you sit in the lobby? What treatments do we need to utilize for you? What's our game plan going to be? So why don't you plan to give me a call and let's talk about that. And I would say the sooner the better, so that the sooner you start coming down with those symptoms, whatever it is, whenever you start to feel like you might have something, give me a call. Let's talk about it. Let's not wait to the last minute, because we do have a 24-hour cancellation notice. That's still true. But as soon as you start to show symptoms, let's get in touch, connect by phone, and talk it through so we can make a plan. Maybe it's wise to leave you home and then postpone, have you come back in a few days or a week or whatever so that we can treat you then. Whatever the case is, it's going to be totally case by case, which is why I say call me. And again, if this needs to change, if this part of the plan needs to change, I will notify you and we'll talk about it just as we are like this, so you'll always be updated on what we're doing and what our plan is going forward. So, as always, if you have questions or concerns about anything that's going on, get in touch with me. I'm here to answer those questions and to talk through some of that stuff so that you understand and feel comfortable. I'm here for that. So you can email me. It's Catherine with a C, Catherine@DelSolCommunityWellness.com, or you can call our office. If I can't answer, or if someone can't answer and you leave a message, just always let us know when's a good time to call you back. Our number is 970-218-7179. You can also respond to any of the emails that you get about appointment reminders and all that stuff. You can always just respond to those. So we're here to talk things through, we're here to support you, and we're here to keep taking care of you even though there's stuff going on that's outside of our control right now. That's all I have on the spread of disease and what we're doing here at Del Sol. That's our plan as of this moment. As with any type of thing like we're facing right now, we may need to change the plan in the future, in which case I'll be in touch then. I am looking forward to seeing you for your next appointment or your next class. And if you need anything, please reach out to me. I'm happy to talk it through with you. I will see you soon. Take care.